Focal cortical stimulation in epilepsy is a new treatment approach, which is targeting the area of the brain in which focal seizures have their onset. And this new stimulation techniques differs from other techniques which have been in place in several ways. So the first way is that it is minimal invasive. So the stimulation electrode is not placed intracranially, but it is placed epicranially, so outside the skull, but over the region which is targeted. The second is that it has a special electrode design, which allows to target brain areas, although you are not in the brain yourself, so to have a particular depth entrance into the brain. This can be modeled, and it has also been measured to some degree in animal models. And the third difference is that you have two different stimulation techniques. So one which has been commonly already used, which is high-frequency stimulation in the range of 100 to 200 hertz. But you also have a DC-like stimulation paradigm integrated so that you can apply different types of stimulation for this focal region. The new technology has been tested in two clinical trials in Belgium and Germany, and it has turned out that this treatment is quite effective, so that it has a responder rate of more than 50% after 6 months of treatment, whereas there's no initial effect, like if you do perform stimulation within the brain, where you have so-called implantation effect, which is a lesioning effect. This is absent, but you have just by the stimulation this effect of about 50% seizure reduction after 6 months. And we have now new data from long-term follow-up also of 2 years, which shows that this effect is continuing, so that the responder rates even grow to 65%. But even more important, there is a growing number of patients who have not only the so-called typical response, which is a 50% reduction in seizure rate, but that you also have an increasing number of patients who have 75% seizure reduction or 90% seizure reduction, which is 40% or 30% respectively. And this is meaningful outcomes in the sense that it can really change the life of the people. And this is also reflected, for example, in improved quality of life, less seizure worries, more energy, more daily activities in the patients who do respond well. To define where you have to stimulate, that is certainly a complex task. So if you perform neurostimulation, you can perform this at different sites. It can be far away from the real seizure onset zone by modulating general excitability of the brain. Or it can be in so-called network hubs where seizures propagate, so that you do not directly modulate the onset zone, but that you modulate the pathways during which epileptic activity uses to manifest then in different types of seizures. But you can also target directly the focus, and this is being used in the US with the RNS system, and it is now used in Europe with the focal cortex stimulation system. Both target directly the focus, whereas the US system is implanted intracranially and uses subdural or depth electrodes to stimulate in a very targeted fashion. The European system is, as I already said, using an electrode which is epicranially, so extracranially. And this electrode is a little larger from the area that is being modulated, which very well fits into some ideas about how DC stimulation has to be applied in order to work successfully. And there have been modeling studies which suggest that you need a larger area to have the efficacy that you want. And there are some studies which suggest this is true. For example, a French study looking at TDCS, so also DC stimulation in patients who had a very exact definition of the epileptic focus by intracranial recordings. And they also found that with smaller foci, the TDCS seems more effective. So I think there's converging evidence that it may be advantageous to have somewhat larger regions to modulate, at least when you use direct current stimulation. And I think it's less clear so with high frequency stimulation, where you may have lots of effects which go beyond the direct area that you stimulate. So the EASEE system is this focal cortex stimulation system that I mentioned already. So it consists of a generator, which is placed like with other stimulation techniques in the trunk region, and then an electrode which has 5 electrode contacts, which is placed above the region of the epileptic focus, with a central electrode which is used for DC stimulation as a cathode, so stimulating by hyperpolarizing neurons in this area and modulating particularly also GABAergic activity. And then there is 4 contacts, which is on a circle around this central electrode, which are the anodes, or with high frequency stimulation, this is equally used. And so this system is minimally invasive, so there's practically no or very little risk with the implantation. So there's practically no adverse events other than tingling in the area where you have to make a skin incision. And otherwise, at least so far, there have been no notable adverse effects being documented of the stimulation technique, which is very interesting because the intracranial systems do have a certain risk of bleeding. They do have a certain risk of infection, which is not extremely high, but which is in the range of 5 to 10% each. So that for a patient, it may be better tolerable to use such a minimally invasive approach. And again, the safety and the long-term efficacy are now known for 2 years and proved to be very good in terms of tolerability and also promising in terms of efficacy.